Good afternoon, everybody. I'll kind of slow walk it here for a second while the waiting room is coming in. My name is Kelly Talby. I'm the Director of Policy and Strategic Partnerships at Kentucky Voices for Health. We're dividing and conquering today, quite a bit going on. Um, so welcome. If this is your first Thrive Kentucky webinar, we enjoy you joining us. If this is a repeat, saying hello to old friends is always good. Alex, you can go on to or Brittany, go to the next slide. Um, for those unfamiliar, our Thrive Kentucky campaign, these are just some of our mission and vision principles that helps drive our work. We want to have a welcome mat, not an unwelcome mat. We want eligibility approaches, not ineligibility approaches. And anything that we can do that removes barriers, improves access, be it at application, through enrollment, at eligibility determinations, that is how we will make sure that all Kentuckians have the ability to have their basic health-related social needs met, and every family and community have the ability to thrive, which is our pipe dream here at the Thrive Kentucky campaign. You can go on to the next slide. Here is just a snapshot of our members and how you can reach us as far as the steering committees. Go on to the next slide. And an evergreen reminder, please let us know if you would like to be a part of a supporting and contributing member to the Thrive Kentucky campaign. We like to keep our continuing education opportunities free and available for community health workers, social workers, targeted case managers, you name it. And part of that is obviously driven by those who can monetarily contribute. So if you think that is a right fit for your organization, please email me at kelly@kyvoicesforhealth.org. I would love to talk to you about how to spend your money in support of our work. You can go on to the next slide. Here is a snapshot of our upcoming virtual programs. Stay tuned for our in-person list and locations to be launched and announced soon. We're working on the details for that. But as you can see here, we have another webinar coming up mid-March, and this will be one of our forums that we host in tandem with the Cabinet for Health and Family Services leadership. Please share. These are publicly discoverable links, of course, but we would love more from your respective networks to join us. You can go on to the next slide. And then just some housekeeping. We have adjusted in recent months how we do facilitate on the back end for security purposes. The internet and Zoom bombing is real. And so there is a little less flexibility, but please keep your lines muted. Please use the chat. As we go along, please drop any comments or questions you might have. We would like to, if at all possible, get to those in live time so that everyone benefits from hearing the response. And so please, no question is too silly or too small. No comment is unimportant. So please contribute today. If you need CEUs, if you're participating today as a community professional who would like that certificate, you will have to fill out the application or the evaluation in the follow-up email from Alex after today's webinar. It'll include your profession, license number, some other identifying info. So please look for that. And yes, the recording of today's webinar, as well as the slide deck, links for resources and evaluation will all be in that follow-up email. So you can go on to the next slide. So today's agenda, for those who join us regularly, is a little reversed in part. The Medicaid Oversight and Advisory Board meeting was scheduled and happened at noon today. So we were a little unsure of the timing and format. So we wanted to be able to incorporate everything that happened at Moab today. So we are a little different order today. We'll get to the legislative session update towards the end. So with that, I'm going to pass the virtual mic to my friend Dustin Pugel at the Kentucky Center for Economic Policy.
Hey, good afternoon, everybody. First of all, it's great to see so many community health workers on today. I don't remember us having all these introductions in the chat in the past, but we need to make this a standard. It's great to see folks from all across the state joining us. I'm going to share a very brief federal update. As we all know, particularly last year, changes at the federal level really do affect us here in Kentucky. The federal government plays an outsized role in our budget. A lot of programs and staff operate here. And so it's really important that we at least get an idea of what's going on at the federal level as it pertains to us as a state. So I actually don't have a ton to update us on this week, but we will share a couple of things. So if we go on to the next slide. So first of all, folks will remember that there was a government shutdown a while ago. As a part of that, there was an extension to January 30th. That deadline came and went for a couple days at least. And during that time, they pulled the Department of Homeland Security's budget out of the federal budget and gave it basically a 2-week extension. That deadline came and went. So now we are back into a partial government shutdown, partial meaning it's only the Department of Homeland Security. That affects agencies like ICE and CBP, but it also affects the U.S. Citizenship and Immigration Services, the TSA, the Coast Guard, and FEMA. So while the negotiations are ongoing, a lot of folks will be sent home without pay, but even more will actually likely need to stay on the job without pay, including TSA agents and Coast Guard officials and others. Negotiations continue. At the same time, though, because of the One Big Beautiful Bill Act, H.R. 1, it's likely that ICE and CBP will continue operating like normal because of the $75 billion and $65 billion provisions in that bill, respectively. We're hopeful that some safeguards will be placed on the operations of ICE, but those negotiations are ongoing. And in the meantime, a lot of these other really critical needs will be in a shutdown, like we were before. If we go to the next slide, just a couple other things to mention. First of all, the Trump tariffs were struck down by the Supreme Court recently, specifically the provision that he was using to be able to do that. And so while those tariffs were sort of immediately defunct, the president turned around and used a different provision to institute across the board 15% tariffs. And while this may seem like a really sort of broad reach or maybe a stretch for what we typically talk about around here, I think it's important to remember that Kentucky is actually one of the leading exporters in the country as far as states go. We have a lot of auto manufacturing, a lot of bourbon, and a lot of other products that end up in other countries. And so these trade deficit talks are really important to how we as a state operate, to the degree to which folks need the kinds of supports that we're going to be talking about later. Also want to mention that the Farm Bill is progressing. This is a Farm Bill that we were supposed to have back in 2022, but it keeps being delayed through these sort of year-to-year extensions. And so it seems like there's some progress being made there. Unfortunately, while there was a really pretty big priority among the minority to reverse the SNAP cuts and particularly the cost shift to states, that's not currently a part of the Farm Bill. So those cost shifts and cuts will continue at present based off of the way it was written. There's also a proposed rule from HUD that would ban mixed status families from rental assistance. These are households where you may have a citizen or a lawfully residing immigrant, and then potentially an undocumented immigrant in the family, either a spouse or a loved one. This would prohibit those folks from receiving housing assistance if that rule were to go into effect. And then finally, there's another rule on the ACA marketplaces. Much like Connect, we are one of those marketplaces. This is an attempt, I think, in some ways to do an end run around ACA protections to provide weaker but cheaper plans on the marketplace, and also to codify some of the changes from HR 1. The good news is that rules are always, subject to public comment. Federal agencies are supposed to take those comments into account when they finalize the rule. So I encourage you all to go seek those out if you have ways in which you want to weigh in on how these programs operate. And with that, I'm going to hand it over to my friend Jordan.
As you might be aware, my name is Jordan Ojal. I am the advocacy manager for Feeding Kentucky, and I'm here today to speak briefly about food security. And I want to start by discussing the state of hunger in the Commonwealth. We're the seventh hungriest state, with over 700,000 people facing hunger as of right now, with 1 in 4 Kentucky children living in a home without enough food. And we have the second highest rate of hunger for people ages 50 to 59 years old. Nationally, we are leading the pack in all the worst ways as it relates to food security. And Feeding Kentucky recently conducted a hunger study across the Commonwealth. And hopefully, by the time the next webinar is done, we'll be able to start including some of those results peppered in as well for some more granular looks at how food insecurity is evolving over our state. Next slide. So, with those numbers in mind of how many people are going without consistent nutrition, let's talk about SNAP participation in Kentucky. With the chart here demonstrating what usage has looked like over the last few years, the average SNAP benefit is around $174 for an individual and about $370 for a household. And as of December of last year, there were only about 597,000 Kentuckians on SNAP. But if you recall to the previous slide, there are about 700,000 folks who are food insecure, which means there's about 100,000 Kentuckians slipping through the cracks. And we are concerned about the under-enrollment, and I know that's a huge priority for the folks at the Cabinet for Health and Family Services in Kentucky. And we are hopeful that we can boost those enrollment numbers up to make sure nobody goes without nutrition if they are eligible to receive assistance. As of 2024, SNAP benefits accumulated around $1.3 billion in Kentucky annually. And we are the 46th in the nation for our SNAP participation rate. Only about 65% of eligible Kentuckians participate. Also worth noting that just because there's 700,000 Kentuckians food insecure doesn't mean that that accurately captures all the folks that are eligible to participate in the SNAP program as well. Next slide. So, as you may have heard by now, HR 1 was the single largest cut to the program in quite some time. It cut $300 billion from SNAP over 10 years, and it's the largest cut in history. And it's at a period in time where grocery prices and food insecurity is already increasing. It pushed the cost of SNAP onto state budgets starting in 2028. And as a result, the cost to Kentucky this year might be between 50 and 250 million. And that's purely because we operate on a biannual budget, which makes it kind of difficult for folks to project what will we need by the time that the cost shift is fully implemented. So they kind of have to project what they might need in that time by allocating for it right now this session. It also expanded the work reporting requirements that put food at risk for at least 114,000 Kentuckians of that 600,000 participating, and particularly jeopardized veterans, people experiencing homelessness, and former foster youth. And as a result, we're very concerned about the far-reaching implications of HR 1, especially as it relates to eligibility for legally residing immigrants, any of the folks that we just discussed in those particularly vulnerable ages, teens over 14, families with teens over 14, as well as older adults, the exact same cohort we mentioned previously that were leading the pack in terms of food insecurity rates on nationally. And last but not least, kind of slipped under the radar, the HR 1 also ended the Thrifty Food Plan, which put healthier food further out of reach as the Thrifty Food Plan scaled SNAP benefits according not just to inflation, but also the cost of healthy diets. And as the cost of goods and services increases, it was important that SNAP scaled with it. And without that, it's very difficult for SNAP to keep pace. That's going to lead to substantial cuts to the amount of benefits that people receive each month. Next slide, please. Federal cuts ultimately result in hungrier kids, and where we're living in a time where 1 in 4 Kentucky children don't have consistent access, that is greatly concerning to us. But it's worth noting that there's some great strides being made to feed kids. Most Kentucky students are receiving free school meals with the community eligibility provision, which is a fancy way of saying Their eligibility for free school meals is determined by whether their school has enough students participating in safety net programs. It's an easier way to cut through thousands of layers of paperwork to just categorically make a school eligible to receive free school meals. 82% of students in Kentucky are qualified, given our rates of participation in the safety net, and 90% of schools utilize CEP to provide free meals, which rely on SNAP and Medicaid enrollment safety net programs. And we're also concerned, in addition to SNAP cuts, we're also concerned about cuts to CA, CFP, the summer options, as well as the summer food service program. Summer EBT and WIC will also see reductions. And we're monitoring a number of bills tracked through the Kentucky State Legislature right now. Most notable of which there are some that aim to regulate what schools can and cannot sell during the school day. Those have some pretty far-reaching implications, but I know our friends at the Kentucky School Nutrition Association are well involved in those conversations at this point. And then we're also monitoring Senate Bill 5, which we think is a great opportunity to deregulate farm to school purchasing, which really opens the door for more local agri participation by our cafeterias. Next slide, please. So let's circle back to SNAP work reporting requirements to dive a little bit deeper there. SNAP work reporting requirements gets as granular as missing reporting 3 months in 3 years can result in somebody losing their SNAP benefits. People ages 18 to 64, caregivers of children over 13, veterans, people experiencing homelessness, or former foster youth must submit work reports saying that they worked at least 80 hours a month or at least earn 30 times minimum wage per week to keep their SNAP. That is greatly concerning to us given that not every county in Kentucky has equal opportunities to work. And the waivers for areas that are being affected by not a whole lot of economic development, those have ended for 112 counties, with just a few exceptions listed below. There are still some exemptions, but obviously this is jeopardizing nutrition access for around 1/6 of our program participants, which is just inexcusable. But there's an opportunity with a concurrent resolution that hopes to exempt veterans. But I will also say we're noticing some commotion on the federal level with a recent discussion around the Farm Bill, possibly including exemptions for the folks listed above, veterans, foster youth, etc. Next slide. We hope that the House budget, when it is released, if it's released this week, will fully fund SNAP administrative costs. That was part of HR 1 is shunting some of the administrative costs to the state. We need 53 million in 2027 and 66 in 2028 in the state budget. It also HR 1 tries to penalize states based off of their error rate. And our rate is well below 6%, which is just the exact threshold that we need to not pay for the cost shift that is coming our way, which is that $250 million price tag that you heard me mention earlier. A couple notes about error rates, though. Payment error rates are a measure of too many or too few benefits being distributed. They are not a measure for fraud, especially when you consider that it is a self-correcting program. If someone is given too much SNAP benefits 1 month, the next month it adjusts. And if they're given too few 1 month, it corrects to give them more the following. It is not a reflection of poor administration, and it varies from year to year. And the future cost of this is between 0 to 250 million. And we're optimistic that given that our current error rate is below 6%, that we should be able to not need to touch any of the dollars that are allocated towards us in this forthcoming budget. Next slide, please. So a lot of conversations are being had right now around SNAP user data. There's currently a bill, or a resolution, I should say, that would require CHFS to share SNAP user data with the United States Department of Agriculture. And this is part of a larger effort started in May of 2025, where USDA sent notices to state agencies asking for access to that personal information. In 21 states, including DC, in July of 2025, entered a lawsuit about the request. And Kentucky was part of that lawsuit. And now there is a joint resolution being pushed by the supermajority in Frankfurt to override that. Obviously, we're very concerned about that. but it's a very delicate situation to get engaged in, and we're hoping to see that this resolution goes no further. But a number of other states have seen similar measures pass, but some states have also just surrendered that data willingly. Texas, for example. Next slide, please. I would also note that there were concerned about a chilling effect of the data being shared. If people know that if they join SNAP, their data is going to be shared with the federal government more intensely, that could make people not want to register for the program at a time we're already critically under-enrolled. Also, a lot of discussions being had around SNAP restrictions. The Make America Healthy Again movement has bandied about the idea of restricting what people can spend their SNAP benefits on. But people with SNAP shop the same as people without, and it's going to be very difficult and onerous to administer, and that may result in some retailers no longer accepting SNAP. It will not increase access to healthy foods. It's just purely a penalty. It's purely a way of preventing people from spending what they view as taxpayer dollars on junk food, but ultimately will not change behavior or decision making, as folks, if they're not allowed to spend SNAP dollars on soda, will just spend their personal dollars. So it is far more worthwhile and constructive to spend that time and energy on nutrition incentives, like the Kentucky Double Dollars program, where folks get cash back or their dollars stretch further at either the grocery store or farmers markets to actually change behavior and increase access to healthy foods. Next slide, please. And as a note, we've heard a lot of rumors about a SNAP nutrition restriction bill dropping in the next week or so. We would also urge Frankfurt to fully fund senior meals, with 1 in 5 seniors in Kentucky going hungry. And we must continue to fund senior hunger through the Department of Aging and Independent Living. We're optimistic that the House budget will include this, but it is likely that it will be in the final draft, given the particular zest and zeal that certain members of the General Assembly took in vociferously advocating for the funding when it lapsed last year, with many of them taking to online to publicly bash the governor and his office for not including those dollars or not allocating those doctors as quickly as they would have liked. So the governor's budget does include for a fully funded senior meal program, and we would ask that the General Assembly match that at the very least. Next slide, please. If you're interested in getting involved or need access to nutrition assistance, I would recommend that you join the Kentucky Food Action Network, which is a great place for you to join similar like-minded folks in anti-hunger work. Kentucky Food Action Network has a number of work groups that are dedicated towards those feeding efforts and making sure that smart, sensible policy is passed and getting folks involved, those with lived experience or expertise, to speak up for their hungry neighbors. Speaking on behalf of Feeding Kentucky, you're more than welcome to check out our food banks and similar food assistance programs on our resource map. And then, of course, you're also welcome to access federal program assistance through SNAP Connectors, the Kentucky WIC website, or the link for senior meals. Next slide, please. I'm going to toss it over to my good friend Hannah, and they're going to talk a little bit more about behavioral health.
Thank you, Jordan. I'm going to try and go quickly through this information. There's a lot to share. So if anyone needs me to speak slower or slow down, please let me know. Next slide, please. All right, so we're going to go over some behavioral health updates. First, I just want to remind folks about the importance of health-related social needs. Everything that we're talking about in today's webinar is related to mental health. Social determinants of health can help determine someone's likelihood to have poor mental health or develop mental illness. Food insecurity, like Jordan was just talking about, poor access to quality of health care, and a lot of other environmental factors. So it's important to take these into account when talking about behavioral health in Kentucky. Next slide, please. So some exciting news that we'll start with today. New behavioral health waivers in Kentucky are moving ahead. And after many, many years of advocacy for Medicaid to provide supportive housing, supported employment, and other community-based services to Kentuckians with severe mental illness, with or without a co-occurring substance use disorder, new services are rolling out. So the 1915I plan, which is now called RISE, was approved by CMS about a year ago. And DMS has worked hard to reach out to recruit and develop treatment providers. So now there are a sufficient number of providers certified in Region 2, which is the Pennyroyal region, Region 6, covered by 7 counties, Region 12, which is Kentucky River, and Region 14, New Vista. And participants are being enrolled in those regions, and we're hoping that more regions will open up soon for enrollment. Another population that had not previously been served with a Medicaid waiver were Kentuckians with mental illness or substance use disorders who were incarcerated. So typically Medicaid coverage is suspended when the member is in jail or prison, but now this reentry waiver allows for treatment to be covered by Medicaid in prisons and DJJ facilities 60 days before release, and then continuing as they reenter the community. So we're excited to end a 5-year period of working on the waiver and seeing it move to implementation in just a couple of months. Next slide, please. Some other waiver updates. The child waiver, which stands for Kentucky Community Health for Improved Lives and Development, is a new 1915C Medicaid program starting early this year for children and youth up to 21 who are high risk because of their significant service needs. So this provides in-home support that's tailored and includes case management, respite, therapeutic services, and home modifications to help avoid institutionalization. And there's a list here of services that are being offered. Additional providers are being sought, and your input on the child waiver regulations is needed. And comments are accepted through the end of March of this year. Several 1115 waivers have been approved by CMS and are in the process of rolling out to full implementation, which again is very exciting. Individuals with serious mental illness are now able to access up to 30 days of medically necessary inpatient treatment. For Kentucky adults needing substance use disorder care, inpatient services of up to 30 days in a facility of up to 96 beds are now Medicaid reimbursable to provide care for those individuals. And there will soon be a recuperative care pilot program to individuals being discharged from hospital care or a planned medical procedure to assure that additional medical support can be accessed as well as care coordination. Next slide, please. So House Bill 2, the Medicaid Reform Bill. This bill was filed by Representative Ken Fleming, who's the co-chair of MOAB earlier this session. And it codifies many of the Medicaid changes that are proposed in HR 1 and put them into Kentucky statutes. So we'll name a few here. I'm just double checking. I updated these earlier with a committee sub that was released, and it looks like these are updated. Wonderful. So a few that we view as problematic include self-attestation. Medicaid members will no longer be able to self-attest their medical status. So this is an additional barrier that will now be in place pending passage of the bill. Community engagement and enrollment eligibility. Individuals applying for enrollment in Medicaid must demonstrate community engagement for the prior month. So the month before the application for coverage is being submitted, then they must demonstrate those community engagement requirements. And redetermination every 6 months. So at each 6-month redetermination period, non-exempt Medicaid members will now be required to prove that they have satisfied the new community engagement requirement for 3 consecutive months of the last 6 months. So not just any 3 months, but now 3 months in a row. Some good potential changes are copay exemptions, which would apply to primary care, mental health and substance use disorder services, and services provided by federal qualified health clinics, community behavioral health clinics, and rural health clinics. And then also community engagement exemptions, which would apply to veterans with disabilities, individuals who are medically frail, put that in quotes, and individuals who are participating in an alcohol or drug addiction recovery program that's recognized by the Secretary. Next slide, please. And then just some other potential changes regarding 1915C Medicaid waivers for Kentuckians with special needs. Again, these are changes that are outlined in House Bill 2. As you all may know, there are 6 1915C Medicaid waivers designed to provide services in the community to Kentuckians who otherwise would potentially have to live in an institution because of the severity of their intellectual, developmental, or physical health needs. These waivers, are critical for the 33,000 plus Kentuckians that they serve. And the waiting lists for these waivers have grown to over 16,000 individuals. It's really important that we work together to advocate to protect these waivers, both in terms of funding additional waiver placements and then also in fighting new requirements that pose additional barriers to applicants and to waiver participants. A couple examples of those outlined in House Bill 2 are physician attestation. So based on House Bill 2, all waiver program applicants would have to include a physician's recommendation for waiver program services and a physician attestation to the primary diagnosis for which waiver services are sought. And that would have to be included in applications for every waiver. Additionally, individuals are required to be a U.S. citizen and a Kentucky resident for 1 year to be eligible to apply for a waiver. There are exempted folks. So this includes members of the U.S. Armed Services, their spouses or dependents, veterans, and those enrolled in a waiver program prior to the effective date of HB 2. Additionally, if there is no wait list for a waiver, then this citizenship and residency requirement would not be applicable. Next slide, please. Another exciting thing to share is that we have recently had an example of how advocacy can be effective. In mid-January of this year, the Substance Abuse and Mental Health Services Administration, also called SAMHSA, sent a letter out to numerous agencies saying that certain grants had been terminated. And these impacts would have been absolutely devastating, with estimates of about 2,800 grants being canceled, totaling more than $2 billion. And a number of community-based nonprofit agencies, including Mental Health America of Kentucky, were affected by these cuts. But almost immediately, organizations released calls to action with many messages going to members of Congress and others with influence in the White House. And within 24 hours, word came from Washington, D.C. that the cuts had been completely rescinded and grant monies were again flowing out to community agencies and the people that they serve. So this is a great example of how advocacy works. Thank you to everyone who used your voice in this example, everyone who's here today, and I hope that this is a good reminder for us that our voices are really important. Next slide, please. I know I'm running close to time, so I'm just going to quickly go through mental health of marginalized Kentuckians is incredibly important, and legislation can impact access to services. Some examples, Senate Bill 150 from the 2023 session instituted a ban on all healthcare given to trans youth under the age of 18 or those questioning their sexual orientation, and made significant changes to curriculum and policies in our public schools, making it less safe and supportive for all LGBTQIA+ students. In September 2024, Governor Beshear signed an executive order banning conversion therapy, which is also often called conversion torture. And unfortunately, House Bill 495 was passed last year, which overturned that executive order and also bans Medicaid payments for services to adults seeking gender-affirming care and hormone therapy. Senate Bill 2 was passed in the 2025 session and bans the delivery or continuation of gender-affirming care for any Kentuckians who are incarcerated. House Bill 4 prohibits diversity, equity, inclusion, or DEI policies and teachings in post-secondary institutions. And in this session, Senate Bill 26 would prohibit DEI policies in grades kindergarten through 12th. And then finally, Senate Bill 72 was introduced this session and has now passed through the Senate to the House, and would allow a healthcare professional and employees of healthcare facilities to refuse services to folks that violate their sincerely held religious, moral, or ethical beliefs, and also protect liability except in emergencies. Next slide, please. Just a reminder that the 988 Crisis and Suicide Lifeline is always there for all Kentuckians. Folks who call are connected to their local community mental health center, depending on their area code. And as a reminder, option 3 is no longer available because of funding for that option being cut by the federal administration. But LGBTQIA plus callers can still call 988 or contact the Trevor Project. Next slide, please. You can go to findhelpnow.org/KY to be connected to services. Next slide, please. Thank you. And then finally, this slide, which you all will receive, just has some tips on checking in with yourself and with those around you to care for your mental and behavioral health. We have screenings available at screening.mhanational.org that are free, online, and anonymous. And as a reminder, community and connection can be a powerful and valid mental health tool. And I think that's it. Thank you.
Hello, hi everyone. I am Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health, and we're going to cover some Medicaid and Marketplace updates. So next slide, please. So I did just wanted to give everyone a quick reminder. Over the last couple of months, we've talked a lot about the enhanced premium tax credits expiring at the end of 2025, and they did, which we definitely saw the impact of those increased subsidies expiring during open enrollment this year, with the average healthcare premium on the marketplace increasing about 36%. And seeing a drop in overall enrollment between last year and this year. The last time that we talked, the House took a vote back in January 9th, and it was still pending action from the Senate, and we are still in that exact same spot. So far, there has not been any action taken from the Senate, and the conversations that had been happening, that we'd heard lots of rumors that there was action, some at least conversation happening about extending them within the Senate. Those conversations have stopped from everything we've heard. So right now we are not necessarily optimistic that there's going to be a last minute or a late breaking change. It's still always possible, and advocacy is still very important here. But we're still waiting on action from the Senate, and we're not hearing any positive signs that that is moving. So just wanted to make sure folks know that's where we're at. Make sure to reach out to your legislators. If you have stories of your premium increasing, it is still really important to let them know what the impact of these subsidies expiring, the increased subsidies expiring, how that has impacted families across the state. So with that, let's move on to the next slide. All right, so there is a new comment period, and it ends March 13th. Every year, the CMS releases the Notice of Benefit and Payment Parameters, or NBPP for short. It is very technical, lots of good things in there sometimes, but this year they released it pretty late. Usually they release it in the fall, with the comment period still being in the spring, to give folks some time to process all of the information, all of the changes that are in there. But they dropped this just a couple of weeks ago. Some of the key proposals that are included is that it would expand access to catastrophic plans, which would also include a much higher out-of-pocket limit for individuals and families, and include multi-year options. Catastrophic plans are really exactly what they sound like. They are just plans that would cover you in a catastrophe. The proposed rule in the NBPP would raise the out-of-pocket limit for an individual to $15,600, and for a family, it would be $27,000. And that would be per year, and every year, really. And then it would also allow those catastrophic plans to be good for up to 10 years. So a family could enroll in a plan and it would stay a catastrophic plan for, they could keep it for 10 years without having to re-enroll. But their out-of-pocket max would reset every year. So that $15,000 is a huge number. It is absolutely it's only going to provide any real coverage during a catastrophe. So that's one of the key proposals. It would also make some changes to enrollment and affordability changes. There are some coverage losses and premium disruptions, the way that they calculate all of that, plus adding some new administrative cost. It would also weaken consumer protections. It would also allow some plans to enter the marketplace that have no network at all. So they don't have an established network. They would be exempt from network adequacy requirements, which just means that fewer folks would be able to enroll in that plan and then go see a provider in network because they don't have a network, which is really unfortunate and very concerning. It would also include more verification hurdles, new special enrollment period and income verification hurdles before you enroll. So typically for a lot of special enrollment periods for life changes like marriage, pregnancy, moving, things like that, you can still provisionally enroll and then submit your information ahead of time so that you're able to be enrolled in a plan and not have a gap in coverage. But this would change it so that you had to have your special enrollment period verified before and submit that documentation and have it verified by the state before you're able to enroll in a plan, which often just delays your ability to enroll in a plan and often guarantees that you will have some sort of gap in coverage. Also very concerning, some other changes around eligibility restrictions, and that would, we've long advocated for a basic health program, but this would really eliminate some of the state control over a basic health program. Kentucky does not have one. We would love to have one, but it would also extend some of those immigration-related limits on premium tax credits to basic health plans as well. Not looking forward to that. And then other big change, last year there was a proposal by the state to actually add adult dental as an essential health benefit within the marketplace. And ultimately that did not go through, but we've still continued to advocate for including teeth as an essential health benefit because they're part of your body. And this new NBPP would also proposes removing that as an option so that states would not be able to have adult dental as an essential health benefit, and any other additional health benefits that have been passed since 2011, they would be pushed off. Coverage would have to be paid for by the state, and the federal government would only cover benefits that go back to the 2011 limit. So lots of really technical, not great things in this proposal. There is this comment period that ends March 13th. It's really important to share your story, share how these proposals could affect consumers, assisters, marketplace operations, all of that. So I've linked to the side. There's more about finding the full rule if you want to read through all of that text and get it for yourself. That same link will also take you to where you submit your comment period. So you can click it, read everything, and then submit a comment all in the same place. I'll also put together shared the fact sheet about this final rule. Our friends at the Families USA, they put together an analysis of this rule that really is very simple and to the point, easy to read. And then Health Affairs also put together a more in-detail summary, and that's part 1 of 4 that are coming. So if you're interested, definitely make sure to share your comment and read those summaries. And if you have any questions, please don't hesitate to reach out. All right, next slide, please. All right, just love to keep this reminder of all of these changes, all of these technical changes that are coming. We already had some big changes at the beginning of this year. The next changes Oh, love that. The next changes that we're looking for are in Medicaid. They're coming up in October and then at the end of the year as well with work reporting requirements. So just like to keep that top of mind as we move through this year. Next slide, please. And I believe now we're going to turn over to HB2. I do want to invite Kelly Tolby on to go over some highlights. There's some late breaking news and want to turn it over to an expert to talk about it. Thanks.
Well, Priscilla, you're also an expert, but it's like I mentioned at the top of the call, you guys, we rearranged today's meeting due to Moab, but we were also at that time not planning on House Bill 2 moving simultaneously. And so we about 2 hours ago got our hands on the proposed House substitute number 2, actually, which means there was a number 1 at one point for House Bill 2. House Bill 2 did get posted onto an agenda late last week. It will be heard in the House A&R committee tomorrow. Now, the proposed House substitutes and the proposed Senate substitutes, you'll see PHS and PSS on draft documents at times. Those are what, upon committee adoption, become the House committee substitute or Senate committee substitute. So I wanted to explain that just a little bit on why we're kind of in a cart horse, chicken egg situation on how we want to share House Bill 2 information with you today. I'm going to drop in the chat both a copy of the proposed House substitute number 2 and the official fiscal note. There's asterisks next to the fiscal note on House Bill 2 because it was written and drafted to the bill as filed and not the proposed House substitute. So there's going to be a big discussion tomorrow. Upon formal adoption of any draft committee substitute, we will be working as quickly as possible to make tweaks and adjustments to our explainer, our list of recommendations, and calls to action. But I want to make it abundantly clear in our quick and dirty read, since we've had this for just a couple of hours, many of the changes that we felt were necessary related to paperwork and copays in particular are largely unchanged. And I'll kind of talk at you, but I want you to know that the next couple slides might not align with what I'm describing from the proposed House substitute. So you can go on to the next slide, Brittany. So the paperwork and eligibility provisions, the self-attestation portion that you've heard already discussed, especially when it comes to Hannah and Mental Health America of Kentucky's concerns, that section is unchanged, unfortunately. So we still have the same exact concerns moving forward. On the paperwork and data checks, an additional data source has been added on a quarterly basis to be updated. And so a lot of the lingering ongoing issues with paperwork, conflicting eligibility determinations, those remain. We will, again, once a committee substitute is adopted, and knowing that this is PHSS 2, who knows if there will be a PHS 3, we don't know. Stay tuned tomorrow for updates and calls to action related. You can go on to the next slide. Copays, we know are a barrier to care. And while we are grateful that primary care and behavioral health are exempt, we do know that this will impact and harm sometimes our sickest Kentuckians, people facing chronic disease management, cancer care, ongoing needs related to that. At my quick glance, and forgive me if I misrepresent some of the information, but the timeline was adjusted for pharmacy and contact lenses and glasses, as well as the amounts. But as far as that $20 copay for higher acuity patients, those remain. And so that does continue to be a grave concern of ours in Kentuckians having their needs met. If you read the fiscal note, you will see that part of the way they explain copays is that it could reduce unnecessary utilization. And that kind of breaks my heart a little bit on a policy scale. And you all, as the community professionals helping Kentuckians navigate this process, know what $20 a pop for chemotherapy or radiation, $20 a pop for dialysis, will mean for the people that you are helping navigate the system. You can go on to the next slide. So again, House Bill 2 is moving. If you are receiving our updates, you should have received an additional updated call to action from Emily Beauregard yesterday and on Friday, I believe, but definitely yesterday, with the agenda for tomorrow, the latest information we have, and we will be updating this tomorrow as quickly as we can to reflect whatever changes they do adopt. This is the point in session where House Bill 2, while it's not received any additional readings, could receive a reading on the floor today. If it does, knowing that tomorrow is when they plan to adopt a committee substitute for it, that will be our indicator on the inside baseball side of things that it's about to move quickly. And so your calls to action are so important. If you have personal experience, if you have Kentuckians currently facing these sorts of scenarios that would be directly impacted, now is the time to let your legislators know what you think about those concerns. If you have some of the recommendations based on some of the materials we've put out. And again, as quickly as we can clarify and update our resources for you, we will be doing that. So stay tuned tomorrow. And I think that was it. And I'll hand the virtual mic back to you, Priscilla. Is that right?
Yes, Kelly, before you hop though, Stephanie dropped in the chat, do copays affect Medicare Savings Program QMB beneficiaries?
I will have to look. I assume you're referring, Stephanie, to dual eligible
Yeah,
population.
yeah,
I don't want to give you a confident answer because I don't have one. So let me look and we can include that in the follow-up materials and resources.
perfect.
Yes, dual eligible. Okay.
Awesome. Thank you, Kelly. And thank you for that, like, very good update breakdown. If folks have questions or other concerns, please feel free to drop those in the chat or reach out and follow up with us offline over email. Okay, so let's transition into talking about child renewals. We've talked about them for the last couple of months. They are back, they are happening. They first restarted back in July 2025. If you are getting a notice, if you have clients who are getting a notice, if you have clients who are enrolled in Medicaid, if their kids are enrolled in Medicaid, make sure that you ask them when their renewal is. We are hearing so many stories about folks losing coverage because they just did not know, they did not receive a notice, just not sure where some of that breakdown is. If you are in a position of working with anyone who has Medicaid, just ask the question. It's not your responsibility to fix it. You can always refer folks to a connector to help them walk through that process, but at least ask the question and make sure that folks know to check for those notices. We do not want to see people lose their Medicaid because they did not get a notice or they didn't respond or they just didn't know what to do when they got that notice. So if folks need help, make sure to refer them to a connector, or if you feel comfortable helping them, you can always call the Connect hotline, reach out to a connector. You can also ask providers at a doctor's office to check KY HealthNet. That portal, it will have the renewal date in the system. So right then and there, they can pull that information for you, and then you can connect them to a connector to complete the process. We also put together this great one-pager that's linked there in English and Spanish, and DMS also has a children's renewal packet explainer as well that's linked there. Next slide. So, and a good reminder, income limits for children are much higher for adults. That's also one of the big things we're hearing. Adults will look at that income limit for them based on their household size and based on what the limit for them is, and they'll assume that the whole family is ineligible. But for example, a household of four, if a family, 2 adults, 2 children, household income is $45,000, the 2 adults would not be eligible for Medicaid. Asterisk. The 2 adults would not be eligible for Medicaid, but the children would be, and they would be all the way up to $70,000. So when in doubt, just fill it out. Let the state make that determination for you. Do not just not fill it out or assume that you're ineligible. It's really important. Next slide, please. And as we're looking at the data for child renewals, next slide, Brittany. Thank you. So this is what January looked like. It's weirdly fuzzy, but overall, overall 45,000 7 to 18-year-olds were approved. 24, almost 25,000 0 to 6 were approved, and then a big bucket, almost 12,000 7 to 18-year-olds were terminated, and 44 0 to 6 were terminated. That's a big number. The caseload was a lot higher. 153,000 Kentuckians went through the renewal in January. So a much higher number of people went through that renewal, but still seeing a pretty high disenrollment rate for children. Next slide, please. So yes, overall, since July, almost 250,000 children have gone through their Medicaid renewal, 243,000. The vast majority, 82%, 200,000 have been approved, but that also means that 18%, 42,000 have been terminated. And of that 42,000, 73% were terminated for not responding to that notice. So 30,000 children no longer have their Medicaid because of not returning a form. And that could be that they did turn something in, but it got lost in the system and they didn't know what to do. They didn't, they turned paperwork in at DCBS and didn't get processed. There can be lots of reasons, lots of barriers that prevent people from being able to submit those documents. But that's why it's so important that if you're working with folks, make sure to just ask the question. If they did experience a barrier, please connect them with a connector. Please elevate that story to me, and I will help work with the state, anything, because we do not want to see these kids losing their coverage. We don't know that they're ineligible, but we do know that for whatever reason, they were unable to respond to that notice. And that is not why we want to see kids lose coverage. Well, we never want to see kids lose coverage. But just putting that out there, and especially concerned about that 7 to 18-year-old age group, that school age group. They are the highest percentage of that, of folks who are losing coverage. And so if you're working with Friskies, if you're a Frisky, again, reach out to a connector, ask the question about the renewal, and make sure to connect folks to connectors if they need that help. Next slide, please. Yes. And what do you do if you lose coverage? Number one, I'm going to just say it, connect to a connector. They can help walk through that whole process. I'm an unapologetic connector fan. Reach out to a connector. They can help walk your clients through that entire process and resolve any issues for them. But it's really important to act as soon as folks know that they've lost coverage. You can go and update your application and connect, reach out to a connector, call the call center, submit those documents. If you realize you lost coverage, you didn't send something in, it's not too late to submit it, but you need to do it as soon as possible. So next slide, please. And great, there's still a monthly stakeholder meeting from Department of Medicaid Services. The next one is March 19th at 11 a.m. You can register there. And it's a great time to just hear updates from the state about all the things related to Medicaid and the work that they're doing. Next slide. And we are still wanting to collect stories about our premium increases. We've heard anecdotes all across the state of folks talking about just how unaffordable and how expensive their plans have gotten this year. We would love to collect some of those stories. So if you know anyone, if you were impacted, if anyone in your life is impacted, just take a couple of minutes and share your story on our collector. We'll be tracking this throughout the year, as we're concerned that as we get further into the year, folks are going to have to make tough budget decisions and might have to drop their insurance. So please share your story, share with friends if you know anyone who might have a story to share. Next slide, please. And then our next Keep Kentucky Covered Coalition is March 18th. We had one last Wednesday. If you have a story you'd like to share, if you want to talk more about some of the nitty-gritty policy things related to Medicaid, Marketplace, legislative updates, anything health-related, come join us. It is open to everyone but the media, and this is our next schedule. It's always going to be the third Wednesday of each month. So come join us in March. Next slide. And then other resources. So we still have our Keep Kentucky Covered toolkit for your advocacy, where we put all of those great one-pagers that we've developed over the last year about all of the data around what those big, beautiful bill impacts will be. We also all have that HB2 explainer that Kelly mentioned. That is in there as well. And then for other resources, we also have kyloop.org that has all of our one-pagers. With health language access, child care assistance, non-emergency medical transportation, SNAP work reporting requirements, all of the things, and all of those one-pagers live on kyloop.org. So check it out if you'd like them. And with that, I believe, next slide. Great, I'm going to turn it over to Adrienne. Thanks, y'all.
Thanks, Priscilla. And hi, everyone. It's good to be with you this afternoon. I'm Adrienne Bush with the Homeless and Housing Coalition of Kentucky. Next slide. Okay, so Dustin had talked briefly during the federal updates about the partial government shutdown, and I would like to complement that with what is in the continuing resolution that is in place through September 30th regarding housing. So it funds the Department of Housing and Urban Development through September 30th. And it provides level funding for the Home Investment Partnerships Program, which is the single largest block grant for affordable housing development in the country. It provides a modest increase to homeless assistance and housing vouchers to account for increased rents and contract renewals. It does include, however, some cuts to traditional public housing, as you will see on the table on the left. Next slide. The good news coming out of Congress, besides a continuing resolution that funds part of the government, is the Housing for the 21st Century Act. It is an omnibus housing bill that passed the House of Representatives 390 to 9 earlier this month. And section by section, it contains a lot of bills that have had bipartisan support, but never made it over the finish line over the past few Congresses. One is the Housing Supply Frameworks Act. Another is the home reform bill that provides some very helpful tweaks to the Home Investment Partnerships Program that I mentioned on the last slide. And it also contains some provisions from the Rural Housing Service Reform Act. It also provides provisions around choice and affordable housing, manufactured housing innovations, and establishment of an eviction helpline. So the Senate earlier in 2025 actually passed a large omnibus housing bill called the Road to Housing. And this is kind of, it's not a one-for-one match. It's not a companion bill. It contains the sections of Road to Housing that there was consensus on moving forward. So the Senate may decide to resume consideration of its Road to Housing Act later this year, at which point a conference committee to pass an updated bill with the elements of both is likely. So we're excited. This is the first time in about 10 years that actual housing legislation, aside from program authorization and appropriations, has gotten through Congress. Next slide. All right, so turning to the state. From our perspective, to address housing stability overall in Kentucky, solutions need to be grounded in 3 pillars. They include increasing housing supply and affordability for extremely low-income Kentuckians, improving access to housing for people who are housing insecure, and creating statewide renter protections. Next slide. All right, so we are fortunate in Kentucky to have a state affordable housing trust fund, and it funds 3 types of projects: single-family home construction, emergency home repair, and rental development. and is targeted for people who are at or below 60% of the area median income, which is for a family of four, making about $52,000 annually. You can see that over the past, since the fund's inception, the receipts that fund it have really leveled out. Right now, it's funded at $6 per deed recording fee and $6 per mortgage recording fee. And that's generating about $3 to $4 million annually, which is not very much at all. Next slide. All right. So why is this critical? Because over half of the houses that are needed to close our housing supply gap are for this income demographic. 60% of the total shortage, in fact. Next slide. House Bill 411 would modernize and index the Affordable Housing Trust Fund. It would raise the fees that fund it to $13 and $23 respectively for a $36 total. And this adjusted amount would yield approximately $10 million per year and a projected 600 additional homes. Indexing the fee would allow the fee to grow over time instead of remain stagnant and have declining purchasing power. And House Bill 411 has been filed by Representative Steve Bratcher from Elizabethtown. Next slide. All right, House Bill 338. Provide automatic sealing of dismissed eviction filings. So evictions across the state, what we have found is that more than half of the filings are actually dismissed. They don't go to judgment. They don't result in the case being found against the tenant. But even those dismissed evictions remain on people's records. And we know a lot of landlords, as a screening tool, will ask about people's eviction histories, run credit and eviction checks that may rely on outdated data that collects eviction filings but not dismissals. And so these evictions stay on records forever. So House Bill 338 would seek to change that, filed by Representative Whitten. It would also provide a legal mechanism for when minors are improperly listed on a filing for their names to be expunged as well. It has been assigned to the House Judiciary Committee, and so we are working on trying to get a hearing for that very soon. Next slide. House Bill 333 is a planning and zoning bill that would streamline regulations for religious institutions working to develop up to 24 units of affordable housing and shelter on their property in commercial or business zones. It would be affordable housing for 0 to 80% of the area median income for 15 years. And it would only apply to cities and counties that already have planning and zoning regulations. And religious institutions or faith-based organizations would have to already own the property as of the first of this year. So it has a lot of co-sponsors. It was filed by Representative Pollock of Campbellsville, and it has passed the House overwhelmingly and has arrived in the Senate, and we are waiting on a committee assignment. Next slide. All right, so lots of housing bills, lots to sort through this session, but I thought I might highlight a few of them based on potential impact to the safety net and also what we think will move. So Senate Bill 9 was filed by Senator Mills, who co-chaired the Housing Task Force during the interim. It has passed the Senate 35-2, is sitting in the House. And it would allow a local government to establish a housing development district and a locally funded, potentially, housing incentive payment program, as well as list communities participating in the Certified Child Care Community Designation Program. So this does not provide any new or any money, but it does provide a framework where cities could and counties could try to do some things on their own. House Bill 536 was filed by Representative Bray and assigned to House Local Government. It is very similar to Senate Bill 9. A lot of the language is, there's some overlapping language. It's not identical, but it's seeking to achieve the same end. House Bills 617 and 618 were filed by Representative Whitten and have been assigned to the House Local Government Committee. These are kind of exciting bills. They sound technical, but they have the potential to release some pent-up building. So they would reduce minimum lot sizes and parking minimums. These are requirements for builders when they are developing housing that may be implemented by local governments that may be driving up the cost before construction even starts. It deems that mixed use development, so think about places that have both commercial and residential uses, that be considered permitted use in all commercial zones, would not have to go for a zoning variance. And then 618 would require that 2, 3, and 4 unit dwellings, so duplexes and the like, would be subject to the same building code standards as your traditional single family. Next slide. All right. Senate Bill 142 was filed by Senator Smith. It would create and appropriate $25 million to a new abandoned home pool fund and direct $2 of real estate transaction fees to this fund over time. House Bill 377, filed by Representative Whitten, has been assigned to the House Natural Resources and Energy Committee. And it would prohibit utilities from disconnecting electric during hot and cold weather and holidays and weekends. Senate Bill 88 is very similar. Next slide. All right, we have some next steps, which will come out with the slide deck, as well as the next slide, which has a few housing resources on them. And with that, I'm happy to turn it back over to Kelly.
All right. You can go on to the next slide, Brittany. I'm going to give a more broad legislative session update. We'll still talk about House Bill 2. I just want to remind everyone that this time of year, every year, can feel a little tense at times, but the issues we all work within are not partisan. It's just the process that is. But your direct experience, the direct experience of those you serve and those within your community, those are real. And shaping those stories, uplifting them, and letting lawmakers know about how barriers affect access to care and the overall health outcomes, that is where we've got a little bit of constituent power. This is a long session, much longer than usual. So they are here until April the 15th when they can adjourn sine die. Tuesday, Wednesday, Thursday is when you will have the busiest days in Frankfort. We've got links galore. And if you go on to the next slide, just to kind of snapshot, we are here, and that's really sad looking. But that I thought this was a nicer visual to put the little arrow there to reinforce how much work and how much movement to these massive policies, big, small, everything in between, including the state budget and the Kentucky Medicaid Reform Act. All of that is happening, even though it doesn't feel like there's something to indicate action between January the 9th and March dates. Upcoming, though, we do have the last days to file bills in the House and the Senate. So you will see a mad dash here soon of remaining ideas, policy suggestions, and sometimes surprises. Sometimes bills and policies are held on purpose until the bill filing deadline. And that is kind of a way to kind of abruptly stifle the process in a way. You can go on to the next slide. Here is our accessibility guide again. You will note that it has been updated once again. This will include some clarity around how to drop off the distribution of materials when you are wanting to leave something with all lawmakers or all lawmakers on a floor. There was some confusion around that recently with a handful of our partner organizations. and the agency has updated their form online. So we updated that as well as information around the lactation room and access there. You can go on to the next slide. A lot of these good bills that we have flagged have either been touched on by some of our previous speakers or we have discussed recently. A couple new ones, though, I want to flag for you there at the very bottom because I don't recall at the last update our school-based Medicaid billing, our school health bill, and the health data utility bill having been filed. School-based health, we will at KVH have a one-pager available soon to help uplift it. It will hopefully be seen as like a positive opportunity during Medicaid's transformation this year. If a school chooses, it is not a mandate that schools must, but if a school chooses to offer the expanded health services to its students, and there are students who are Medicaid eligible, with parental consent, it would require those schools to bill for Medicaid. This would not greatly impact the state's general fund because by virtue of having a mental health professional or school nurse on staff, that school is putting up the state match in those ways. But there's money left on the table if they do not formally bill and draw that federal funding down. And then they'll also include some additional training and supports for our schools. And this is hopefully a step of several probably left to go, but one serious step in achieving and unlocking a school nurse in all schools every day, all day. Wouldn't that be wonderful? House Bill 676, sponsored by Representative Raymer, the health data utility. You've heard us talk about all payer claims databases before, and this is an additional evolution kind of in that data transparency and utilization regards. And it would allow additional data sets such as public health data sets to be incorporated for more live time access and understanding, not just for providers and patients' needs, but it would let lawmakers have more informed opportunities. Going to the next slide, and I just saw the clock, so I'm going to try to speed it up here. Good bills in the Senate. I actually don't know if we added any since last call. And some of these, Senate Bill 5, I know Jordan mentioned as far as the Child Nutrition in Schools bill. SB 142, I know Adrian mentioned and discussed. SCR 9, the feasibility study around the accountable communities for health as a Medicaid model. If that is passed by the House, it has already passed the Senate. It would take a step for Kentucky to consider not using a managed care model. It wouldn't mean that we are abandoning the managed care model, but it would be the state choosing to take a more serious look at different Medicaid deliveries. You can go on to the next slide. Some concerning bills to watch. Several of these have also been mentioned by my colleagues. Senate Bill 72 that Hannah mentioned. That moved, I believe it was last week, but time is weird for me this time of year. But it has advanced and is in possession of the House at this time. The House Bill 312 that moved a few weeks ago, I did notice that tomorrow or the following day in the Veterans Committee in the House, they've got a machine gun bump stock bill. And I feel like that is probably a little bit of a partnership for concerning legislation and then one that might have a little bit of gun control in a positive way. You can go on to the next slide. Important bills to monitor. House Bill 2 and House Bill 500 we have already touched on. Dustin is going to talk a little bit more about the budget here next. I want to draw your attention to Senate Bill 218 and House Bill 689. They were filed late last week, and they are companion identical pieces of legislation related to retroactive implementation, which is allowed under the One Big Beautiful Bill for Kentucky to continue establishing its Medicaid state-directed payment program. It's definitely one to keep an eye on for all intents and purposes because of the scrutiny and the dollar and cents magnifying glass this year. I would just beg that it maybe clarify where that funding is coming from, since making assumptions right now feels scary. And then the Article 5 convention bills. If you all saw any of the news last year or last week, you noticed that Florida Governor Ron DeSantis was in Kentucky helping promote some legislation. The Article 5 convention bills are perennial pieces of legislation. But in my almost 20 years of monitoring the process in Frankfurt, I've never actually seen them get hearings or receive kind of national attention. So it is a part of our United States Constitution that is uncharted territory. Um, and it requires 34 states to adopt a formal application in order to open the U.S. Constitution up for additional amendments. And it might move. So just wanted to flag those for attention. Mules. Watch this space. In the days and weeks to come, there are many shell bills. Sometimes people call them shells, mules, where in their additional official filing, they are essentially empty. They're nothing but a shell. And then they're sent to a committee. A committee substitute will be attached to them. And there are quite a few by relatively influential members in both the House and the Senate. So if any of those begin to take shape, especially in respect to the budget and fiscal matters, we will try to alert this group as quickly as possible. Going to the next slide. We've already discussed Moab earlier. It met today. Emily Beauregard testified and spoke about House Bill 2 and did wonderful, giving some insights around our concerns that we shared with you. You can go on to the next slide, Brittany. I'm going to go fast. Here's our committee meeting schedule again. The House A&R Committee, Tuesdays at noon. That is the meeting tomorrow for House Bill 1 related to the federal voucher program, and House Bill 2, the Kentucky Medicaid Reform Act, will be heard and voted on tomorrow. Go to the next slide. Facts and fiscal notes. This just updated today. So this screenshot is out of date. And we are quickly trying to absorb whatever the governor has put out to see if they match or are different from the official fiscal notes on the legislative pages. You can go on to the next slide. And just a reminder how important it is to raise your voice, speak up, speak out. If we can be resourceful to you on these or other matters, we hope you will lean on us to help give you some updated resources and tools. And with that, Dustin, I will let you close it out with the budget.
All right, I'm going to try to do this in 7 minutes. So if we go on to the next slide, just want to say real quick that we have a biennial budget. When we budget, it's for the next 2 years, and it's the most important document that we as a state produce every year or every 2 years. And so if we go on to the next slide, the current budget, as introduced, went through a different process than it has in the past. Chairman Petrie introduced this as a bare bones budget. He said this is just the base of each agency's funding, and from there, we'll hear you all out and make changes. It's usually kind of the other way around. Usually, there's a set of subcommittee meetings. They hear everyone out, and then they propose a budget. But in this budget, there's a lot of cuts. It's not just the base; it actually cuts below the base, which is why my cheeky subtitle at the top talks about this as a cutting to the bare bones budget. The thing that I think got most people's attention was the change to the Kentucky Employees Health Plan, where they capped the amount that the state would kick in, which would result in a 72% increase in premiums on average for 310,000 Kentuckians who currently work for the state or some administratively attached agency or have retired but haven't reached 65 yet. There's a lot of other cuts in there, though, and you'll get these slides. You can kind of look at what those include. If we go to the next slide, just to reiterate that increase in premiums, this looks at how much each member's benefit would be cut by month. The most remarkable one to me was, that bus drivers earn about $15,500 a year, and their insurance premiums would rise by about $6,000, which means their take-home pay would be about $9,000 a year, $9,500 a year. That's untenable. And so this is something that I know a lot of legislators have heard about, but it's not the only part of the budget, obviously. If we go to the next slide, I think it's important to know that, our money pays for a lot of really important things, including P through 12 education, but obviously Medicaid. And we talk a lot about Medicaid on this call. The next largest appropriation sort of classification would be the criminal justice system, then post-secondary education, and then all the rest of health and family services. So the things that Jordan was talking about, the things that Adrian was talking about, and others, that's all about 7.4% of the budget. And if you take everything else in the budget, it's about 12%. Now that money comes from a variety of sources. And if we go to the next slide, the biggest state source would be our general fund. This is the fund that's populated by all of our taxes, our income tax, sales tax. I'll talk more about that later. But the single largest funding source is of federal funds, and about 2/3 of that bar is Medicaid. So we bring in about as much in federal funds from Medicaid as we do through our entire general fund. It's a really significant appropriation that reaches every part of the Commonwealth. The next two are restricted agency funds and then the road fund. If we go to the next slide, if we break down that first bar, the general fund, the money that we bring in comes from sales and use taxes, individual income taxes, corporate taxes. Everything else is about 10% when you add it all together. The two big ones, though, are the sales and use tax and the individual income tax. Now, the income tax used to be our largest source of income until we started cutting it several years ago. If we go to the next slide, you'll see that the individual income tax has been reduced over time. It started as a 6% graduated income tax, meaning those who had more paid a higher rate. It was flattened to 5% starting in 2018, and then starting in 2022, it was reduced by a half percentage point at a time. We have now hit, as of January, 3.5%. But every half percentage point reduction is about $718 million, meaning we've reduced our revenue by about $2.1 billion a year at this point. In law, the goal is to get to a 0% income tax, which would obviously be a very, very large reduction in the amount of revenue we have available to us. If we go to the next slide, that is already starting to take effect. If you adjust for inflation, Kentucky has returned to an era that we haven't seen since the Great Recession, where revenues are declining, and the consensus forecasting group estimates that we're going to see that again for the next 2 coming years. And that's without any further cuts in our income tax. So the punchline here, if we go to the next slide, is that the pie is shrinking. All of these things that we've talked about, all of these priorities that we have that we want to be able to fund, they're all coming from a smaller and smaller pie. Now, the dollars may go up in real terms and nominal terms, so the numbers may get bigger from year to year, but once you factor in for inflation, as all of us who try to balance our own budgets at home know, it's less and less over time. And so now if you look at the general fund as a percent of the Kentucky economy, it's about 5.3%, whereas before in 1990, it was about 7.3%. Every 1 percentage point on this chart represents about $2.6 billion. So in other words, if we had just kept up where we were after the Kentucky Education Reform Act, when we raised money to be able to fund an equitable system of common schools, we would have had about a little over $5 billion to be able to work with, more than we do now. Now, if we go into the next slide, I want to just point out that the House proposal, even with a smaller pie, doesn't spend all of the money available to it. So if you add up all the branch budgets plus the transportation budget, and you look at how that spends the general fund compared to how much we have in official estimates, the legislature at the moment leaves a little over $1 billion on the table. That's after cutting Medicaid by $800 million over the course of it, well, in multiple funding sources, and many other things, including this employee health plan cut. But I just say that to say that there's plenty of money left, even with a smaller pie, to be able to appropriate to meet our needs. And the first stab at the budget does not do that. If we go to the next slide, the reason for this is that, again, as I said earlier, the goal is to get to a 0% income tax. And you can't do that if you budget all the money that you have. So there's been a design to leave money left over for many years now, in the hopes to continue to cut it. But if you look at that yellow bar, that's what we've already cut up to this point, that $2.1 billion. That's more than our K-12 base SEEK funding. That's about 2/3 of what we pay for Medicaid. So it's a really significant amount. And I think as we move forward, we need to think of our entire budgeting process as a process of prioritization, not just what we're spending, but what we're bringing in. And as we continue to have this conversation through the end of session about how to budget for the next 2 years, I think we also need to make sure we have enough money to do that. So with that, I think we're going to wrap up.